Welcome to Podcast 83, a regular look at the news, stories, and trends related to Michigan's 83 counties from the Michigan Association of Counties.
Good afternoon, everyone. Welcome to the Podcast 83, the podcast put on by the Michigan Association of Counties. My name is Steve Currie, the Executive Director of MAC. And today I am joined I'm with Andy Hetzel, who's the VP of Communications at Blue Cross Blue Shield of Michigan. Andy, how you doing?
I'm great today. I'm talking to you from my office in beautiful downtown Detroit in Wayne County, and I can't wait to engage with you guys and your audience today.
Well, that's great, Andy, because healthcare is obviously a hot topic no matter the time of year. It's important to counties, important to everyone, and there's been a lot of changes, and Blue Cross has been working on a lot of different things. So let's start off right away. You guys have kicked off a new campaign, a new affordability campaign. Can you tell us a little bit about what that is, what that means?
Well, what it is that it's an attempt really to engage and meet people where they are right now in terms of how they think about the cost of healthcare. And we've done a lot of research. We do it every day. I mean, we talk to our customers every day. We hear from them every day. We hear from our members all the time. We have a great voice of the customer program here at Blue Cross where we take in information and we analyze it. And, what are our customers concerned about? Across the board, people are really concerned about the affordability problem that is in health insurance. And that stems from cost problems that are upstream in the system in terms of how much healthcare costs, because anybody that has any type of insurance, it could be property insurance or health insurance or otherwise, the cost of that product is impacted by the cost of claims upstream in the system. We've learned that a lot of our best customers don't know about the cost pressures that are upstream that are forcing premiums higher and really putting a lot of pressure on their health insurance. And so we've put a lot of information online at our corporate blog, mibluedaily.com/affordability. There's a ton of info out there to help people better understand these cost pressures and how they're impacting the affordability of health insurance today.
Yeah, it makes sense when you make the property reference, everything's costing more now, right? If you're getting, you have a flood in your basement, you got to get the flooring redone or the walls redone, it's costing more. So the same thing's happening in healthcare, it sounds like. How did you guys get at this campaign?
Well, again, I mean, we're listening to our customers. I mean, they're confused, they're concerned, they don't have context for what's happening upstream. I mean, when you take a look at the cost pressures, again, going back to the property insurance comparison, when there's a hurricane and property insurance has to pay out damages, everybody's property insurance costs go up. And right now, what we've been experiencing for the last 20 years is akin to that. We've seen hospital prices increase by 250% since 2000. That is 5 times greater than inflation over that period. We have seen the cost of medical care rise 40%, which is far greater than the rate of inflation. And last year, Blue Cross paid 15% more in pharmacy claims than we paid the year before, which again is 5 times the rate of inflation. And those extraordinary cost pressures upstream in the system are being felt now downstream. Last year, Blue Cross Blue Shield of Michigan paid $1.04 for every $1 we took in premiums. And whatever business you're in, if you're running that type of business, you're under extraordinary pressure. And unfortunately, we are passing that pressure along to our customers right now in the form of double-digit premium increases for their insurance plans. We don't want to do that. No business wants to do that to their best customers. And so we need our customers to better understand what's happening so they can work with their agents, so they can work with us on solutions, and so they know that we're committed to finding solutions for them.
So is that can you tell me a little bit more about the affordability campaign, what that means? So you talked a little bit about the cost pressures, how it impacts customers. So how does it all meet? What does that mean?
Well, online at mibluedaily.com/affordability, you can find out for yourself. But really what we're trying to do is we're trying to give line of sight for people into what's happening in the system because they're paying for it. So prescription drug costs, why is that important for people? They're rising exponentially. The drug companies have the ability to price their drugs however they want. There's no regulation. They have patent protection for 10 or 15 years, so there's no competition. And all of that stuff adds up to extraordinary pressure that people pay for. And we want people to understand not only what is happening, but why it's happening and what Blue Cross is doing about it. One of the great stories that I've been telling recently is about a drug named Humira. Okay, Humira has been in the market for 10 plus years. It's an anti-inflammatory. It's used to treat a lot of different conditions. Its price tag is about $6,500 per month per member. And it's one of the most prescribed drugs on the Blue Cross formulary. And so there's no competition for that drug. So the price is what it is. And we negotiate discounts down, but we can't get them all the way down. And so there's extraordinary cost pressure on group employers, on the counties that pay for benefits, whether they're self-funded or whether they're fully insured. They are paying the extraordinary cost for drugs like Humira. So one of the things that Blue Cross did most recently is we have a relationship with a company. That company has sourced a biosimilar to Humira. We're offering it in the market, and the price is 90% less for the same clinical benefit. That's just one example of what we are trying to do to address the affordability concerns that are mounting for our customers all across the state.
Yeah, so it sounds like you've listened to your customers, you've heard, hey, these costs are expensive, so you're providing some transparency to the process of healthcare and what it all means. Great example on the prescription drug. What other changes do you see that need to be made through the healthcare ecosystem to address the affordability issue?
Yeah, we need to stop paying for healthcare like we've been paying for it for 90 years. We have to stop. For 90 years, how we've paid for healthcare, it's kind of like the grocery store checkout line. When you go into the hospital, every test, every every bag of fluid that you get in your arm, every blood pressure that's taken on you, everything that's performed on you, it's like the grocery store. It's like beep, 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 everything that's done. And then you get out of the hospital and maybe your condition hasn't improved at all, or you have problems in recovery and you find yourself back into the hospital. That money was not well spent on you. And so rather than paying fee for service payments to the health systems like we always have, what we're trying to do differently is we're trying to have part of their payment focused on results. We want to pay for results, not for volume, because hospital care is still a volume-based business. The more services that are performed there, the more that the insurance plan and the member are billed for those services. We want the health systems to put a little bit of that money over here into a performance-based reimbursement system, a value-based care system. So on a population basis, we can reward them for success in keeping people healthy when they leave the hospital, not coming back, not making errors during surgery that require more treatment. Those types of things on a population basis, that will result in significant savings down the line. We want to change the game in how we pay for healthcare.
Yeah, so when you're talking about a results-based system, does that mean, like, for example, I break my leg gets fixed? Hey, you're going to get paid for that. Is that kind of what you're referring to? As simple as that?
Simple as that. We want the care to be delivered the right way the first time for the right outcome. But we also want to make sure that if you have surgery for a condition and that surgery is successful for your condition, but then you're readmitted because something happened during that surgery that was unexpected, we want to make sure that doesn't happen. And for the last 20 years or so, Blue Cross and leading physicians across Michigan, leading health systems across Michigan have built these programs. We call them collaborative quality initiatives, where we're all working together. And we take a look at how care is practiced in Michigan across common and ordinary care procedures. And we depend on the doctors involved to tell us what's working, and then we fund those efforts, and then they tell their colleagues about it, and we start best practices across the state. Those efforts in total have really made a difference. They've saved more than $6 billion in the healthcare system over the last 20 or so years. That is money that has not been computed into the health insurance premiums for our members. It's avoided costs that hasn't driven up health insurance prices. And we need to do more of that. We need to double down on that effort because it's making a difference.
Yeah, and then of course the preventative things that people can do for themselves, getting your annual physical, all those are still important in that because that helps provide a positive result, correct?
Absolutely. Absolutely. And, health insurance plans these days provide a lot of free benefits. We want our members to use them. So, free vaccinations, free wellness visits, free services to, do what you just said. Prevent yourself from getting an illness or having a condition that leads to more expensive health care. We have a personal responsibility, each one of us, to manage to our best health, working in concert with our doctors. Blue Cross is enabling that, having the largest network of doctors in Michigan. We have now virtual care where people can talk on their cell phone with a doctor any time of the day. We want more access points. We want people to get preventive care because it lends itself to better care and lower costs.
Yeah, it seems to make sense if you have the insurer and the doctors working towards the same goal, that costs should go down instead of, people kind of butting heads in that process. Great information today. Andy, is there anything else that maybe we didn't talk about that you wanted to add?
Plug my site one more time,
Sure.
mibluedaily.com/affordability. That is public information. We put it out there for everybody to use. We hope that it's beneficial. A lot of organizations are going through, difficult conversations right now with their insurance agents, their insurers. Doesn't need to be Blue Cross. We hope that information helps provide information, context, and understanding for what's happening.
Well, great, Andy. Thanks for joining us today. Thanks for Blue Cross Blue Shield being a strong sponsor of MAC over the many, many, many years that you guys have. And we appreciate your time and look forward to working with you folks in the future.
We
Thanks, everyone. Have
appreciate
a
it.
great day.
Thank you.
Thank you for listening to today's episode of Podcast 83.